Hello, everyone. All right, Maxime Bernier is tweeting, and I want to focus on healthcare. All right, so Maxime Bernier tweets. This was September 16, 6:02 a.m. 2018. Okay, one, misleading title. A PPC, People's Party of Canada government, could not pursue anything since healthcare is a provincial jurisdiction. Ottawa should respect the Constitution. What we would do is get federal government out of the way and allow provinces to experiment and be responsible for outcomes. And there's a link to a CTV News interview. We're going to get there, but not quite yet. I'm going to read the rest of the tweets first. Two, it's time we break the taboo surrounding the role of the private sector in healthcare. I agree that we should not be following the American model, which costs a lot more than ours and excludes too many people without insurance. But that's not the only model available. Three, apart from the US, all other OECD countries have mixed universal healthcare systems without a public monopoly like Canada. They all provide more services through the private sector. They are also all universal systems where everybody is covered by public and private insurance. Four, patients have a lot more choices than Canadians. They can be treated in public or private hospitals, with the government paying for the treatment. In Germany, Australia, Spain, France, and Italy, more than 1/3 of hospitals are private and for profit. In Canada, it's 0. 5. These countries all perform better than Canada on healthcare, all caps. Nobody is left aside because of low income. Wait times are non-existent or very short. Nobody is denied care while waiting months or years to receive treatment, like in Canada. 6. We should get Ottawa out of the way and get rid of our dysfunctional system for funding healthcare and replace it with another that will give the right incentives to provincial governments to adopt the necessary reforms. Read my proposals. And there's a link to the proposals. Okay, so we're going to go through a couple of things because I was like, really? Are we really that bad? Are we really that bad? And yeah, I think we're really bad. We're really actually pretty bad. So here's an article from the Globe and Mail published in 2012 originally and updated in March of 2018. And I was surprised when I read this. Like I knew Ontario's system was bad, but I didn't realize like that we're pretty crappy. Our healthcare system is pretty awful, and that's well known. So okay, so I'm looking at a Globe Mail article, and the title is "The Best Healthcare System." The numbers say otherwise. So, quote from the article: a host of studies shows that Canadian healthcare system is middle of the pack at best, except for cost, private and public, where it ranks near the top. The studies use different methodologies and weigh factors differently. No single one is determinant, but most point in the same direction. The myth about Canadian Medicare is just a myth. Is just that, a myth. Okay, and I scroll down a little bit, and link is in the description, as with everything I talk about. Asked how many patients could get access to next-day appointments, 22% of Canadian doctors said it was possible. The lowest by far of the 10 countries. In France, it was 86%. In Switzerland, 62%. Netherlands, 61%. Germany, 56%. Britain, 55%, and so on. And Britain's NHS is falling apart. And they can get next day appointments? Are you kidding me? Holy crap, really? So I was like, and that's true. I had a doctor's appointment, and I called, and my doctor's pretty good. I've known them for a long time, and it was still 3 or 4 days that I had to wait to just go in initially for an appointment. So, and I know other people who do not have a general practitioner, a GP, because their area just doesn't have a doctor. So, I mean, what? Like, all right, we don't actually have good healthcare. So anybody who's saying that we do, there are other systems that work much better than ours. Quote, asked, back to the article, asked whether their practice had arrangements for after-hours care, Canadian doctors stood second last after the United States. The number in Canada was 45% compared to 94% in the Netherlands, 90% in New Zealand, and 89% in Germany, and so on. Canadian family doctors reported the second longest wait times for patients to see a specialist among the 10 countries. Canada had the third worst score for the third time taken in getting access to diagnostic tests. We live in an electrical age, except for Canadian Medicare, at least relative to other countries. Canadian family physicians had the worst record for responding to questions online, the worst for making appointments online, the worst for issuing refill prescriptions online. Okay, and yeah, that's true. I have to call my doctor. I can't log into the website, even though they do have a website. I can't log into it, and I mean, I can't log into it to make an appointment. I'm sure I could log into it if they had a login thing, but that's not the point. I don't have a have a way to do that. So yeah, and I mean, the internet's been around for a while. Hey, I remember Taco Bell had a website in like 1997. Yo quiero Taco Bell. So this is a speech that Max linked at the end of the tweet stream, and I could not get my highlighting app to work with your website, Max. So sorry about that; it didn't work. So I moved it over to Google Docs, and so here it is. I'm going to read you some of the points, and there's some of the points that I just made in the Globe and Mail article, and I wanted to show you that this is from October 2016. Okay, so this is October 2016 because it made me smile. I was like, oh, you were so right, Max. You were 100% right in your prediction. Okay, so good morning. Provincial and territorial health ministers are meeting today in Toronto to discuss a new health transfer accord with Ottawa. That's great. They will be joined by their federal counterpart tomorrow. The topic is of utmost importance. Poll after poll has shown that Canadians consider access to healthcare their top priority. Yet I can make one prediction. This meeting is not going to solve anything. What we're going to see is a bunch of bickering politicians failing their primary responsibility, which is to find more efficient ways to offer first-class healthcare to all Canadians. And at the same time, deal with the fact that the healthcare costs are increasing at an unsustainable rate and putting more and more financial pressure on the budgets of all governments. Okay. We already know the scenario. The provinces will beg Ottawa for more money. The federal government will try to impose its priorities over how and where the money is spent. All this despite the fact that healthcare is an exclusive constitutional responsibility of the provinces. Whatever happens, more and more money will be spent, but Canadians will not get better services. And they won't know who is really responsible for this. I blame Justin Trudeau. That's who I'm going to blame for this one right now. But the jury's still out. It could be somebody else's fault, but I think it's his government and all of the other governments previously who've been trying to centralize healthcare spending in the federal jurisdiction when it's a provincial entity, or it should be anyway. It should be managed by the provinces as they have to fund it, and then beg the federal government for money. And everybody wants more money. All the doctors want raises. All the nurses want raises. Just getting beds in hospitals is very expensive because of all that overhead, all that cost, right? And cost of retirement packages, et cetera. Like all of that stuff costs, all of those costs adds up. But if you download the taxes, if you reduce federal taxes, and I mean, that's an important part. You can't just keep taxing everybody that high and expect everybody to go along with us. But if you reduce the federal taxes and say, hey, provinces, you've got your population, you deal with your healthcare costs. Now, I had the same concern. What about the Maritimes, right? What about low population provinces that potentially don't have the money, right? So Max addresses that. I'll get to that. I'm going to go back to the speech now, okay? So why are we in this situation? It cannot be because Ottawa is not contributing enough to healthcare funding. The amounts transferred to the provinces have increased by 80% between 2006 and 7. And this year, from 20 billion to 36 billion. Meanwhile, all other federal program spending only increased by 50%. Okay, so that's a massive increase. And remember, this is from 2016. So he's citing solid numbers. I'm not sure why he's going back a decade, though. That's far. Anyway, so we expect this increased funding to help solve the access problem plaguing our healthcare system, but it did not happen. Canada has the dubious distinction of having the worst wait times among developed countries. Fantastic. The problem is not money, and I'm jumping ahead on the speech. If you want to read the speech, please check it out. Link is in the description. The problem is not money. Back to the speech. Canada is among the OECD countries that spend most on healthcare when we adjust for age. The fundamental problem is that we are the only developed country where the government has a monopoly on medically required care. Apart from the US, all other OECD countries have mixed universal healthcare systems without a public monopoly like Canada. They all provide more hospital services through private sector than Canada, yet they are also all universal systems where everybody is covered by public and private insurance. Patients in these countries have a lot more choice than Canadians. They can be treated in public or private hospitals with the government paying for the treatment. In Germany, Australia, Spain, France, and Italy, more than 1/3 of hospitals are private and for profit. In Canada, the proportion is 0. Why can't we do the same? Why can't we reform our healthcare system to make it more flexible, less bureaucratic, and more responsive to the needs of patients? And I jump down again, and this is where I'll leave this speech here. And again, please do read it. It's interesting. So Max says, I'm giving my opinion here not as a politician who proposes to do these reforms, but as a citizen. I would like my parents, my 2 daughters, and all Canadians to benefit from the same efficient healthcare system, but it's up to the provinces to implement these reforms. Ottawa can only set up the right conditions to encourage them to do so. And we've seen, back to me, we've seen how much damage a bad prime minister can do. I wonder what a good prime minister would be able to do with working with good provincial premiers all across the country. Can you imagine? You know, somebody working in good faith trying to solve the problems. And I really, truly don't believe Justin Trudeau is working in good faith with anybody at all. Okay, back to this healthcare debate. Private health. This is a York Region news article that I found, and I thought, and it's from 2014, and I thought, well, this is kind of interesting, and it proves the point too. So, quote, private healthcare in Germany better than Canadian system, Fraser Report. And yeah, Fraser Report, again, be wary of your sources. Everything has a political bias. Everything is trying to push your narrative one way or your thoughts one way or the other. So be aware of that. Read the report with a grain of salt, but understand that on almost all of the reports, Canada rates low, very low. Worst in the developed world. It's unbelievable. Okay, so despite spending substantially less on healthcare, Germans enjoy shorter wait times for emergency care, primary care, specialist appointments, and elective surgery than Canadians, he added. 5 years ago, as an age-adjusted percentage of GDP, Germany's total healthcare expenditures at 9.8% were 22% lower than Canada's at 12.5%. So the Germany's GDP expenditure was 9.8, Canada spent 12.5. I don't know why the 22% distinction was needed, because it doesn't really make a difference, but whatever. Okay, among developed countries with universal healthcare, Germany's total healthcare spending was 1% less than all country average, while Canada's was 26% above the all country average and among the highest, period. The Institute contended that its study showed the Canadian system would improve greatly if provinces followed the German model and allowed more private competition in the financing and delivery of care. Okay, so with all of that in mind, this is what fired off the tweet storm at first anyway, the actual article linked, or the interview linked. Misleading title, a People's Party government could not pursue anything since healthcare is a provincial jurisdiction. So with all of that in mind, they put two-tier, like People's Party under Bernier to champion two-tier healthcare system. Okay, that's not mentioned. That's not mentioned in the interview. So, and we're going to watch the healthcare part. This is the whole healthcare part of the interview. Link is in the description. Please watch it all if you're interested. Here we go.
You remember Stockwell Day when he was a leader and he put up no two-tier healthcare? Do you remember that sign? You are now advocating for more private healthcare. That's supposed to be a third rail. How does that work? People don't want private health care in a country because they're concerned about fairness.
Yeah, but you know, I'm running on 4 principles: individual freedom, personal responsibility, fairness, and also respect. I want to respect the Constitution. I will respect also the Healthcare Act in Canada, and we can do that. We have private delivery right now in this country, and if you look at other countries, they are having a mixed system, and it's a better system than us. I'm not looking at the one
But we have private health care because people aren't enforcing the Canada Health Act. You know that. Are you going to dump the Canada Health Act?
No, I won't. You don't have to touch that for being having
well, then you don't enforce it. The truth is you have to not enforce it.
No. If you read the legislation pretty well, you'll see that you can have private delivery in healthcare in Canada. So what I just want a better system for Canadians.
But what if you, a rich guy, is going to get better health care than a poor person? What if you get, I mean, is that the kind of Canada you want? I mean,
no. What I want, I don't want people to wait for when they need services, healthcare services. I don't want them to wait too long, and they're waiting too long right now. And every provincial government, they're putting some money in the system and more money.
But the federal government gives about 22% of the money for healthcare. Would you consider that?
But what I want to do, I want to stop federal transfer in healthcare. It's a provincial jurisdiction. So we want to lower our taxes at the federal level and let the provinces tax for their own responsibility.
But where does the money come from?
The money is coming from the same people.
But if the federal government doesn't transfer 20% or 22% of healthcare, what happens in a place like
New Brunswick?
What happens?
We have the equalization formula for that. We have a formula in the Constitution to help, for sure, to help the poor province, and that's why it is there. So everybody must have the same level of services across the country. So we just have to respect the Constitution.
All this, I believe, is authentic with you, and I've known you for a long time. You've been talking about this for a long time.
I'm not afraid to do debate like that, because I know it's best for this country.
I buy that you believe.
Okay, and I'm going to leave it there, and they go on to immigration, and he tries to get very combative again on that one. So I thought that was a good interview for Bernier. I thought it was a good. The host's job is to hold him accountable. I'm glad he's being held accountable because he needs to defend his position, and I think he defends it well. But I think you need a lot of primer to understand. We're not talking about trading a good system for a bad system. We are looking at trading a bad system for a really good system. Do we want 20% lower costs? Do we want lower wait times? Do we want more access to healthcare? Do we want our friends and family and sons and daughters and grandparents to have access, or mothers and fathers? Do we want these people to have access to better healthcare? Why can't we have, is it such a sacred cow that we can't even have the conversation? Is that how far we've gone? It seems crazy when the facts of it fly in the face of the narrative that the news is trying to push. You can't touch healthcare, man. We've got it too good. Who? Who exactly has it too good? I know Ontario doesn't. Kathleen Wynne's out of that. So I don't know. I hope that Ontario and Quebec see this as an opportunity to have a conversation about how to get better healthcare rather than trying to vilify a politician who's trying to talk about ideas a little bit outside of the box. I think it's a great idea. Thanks, Max. Check out the People's Party of Canada.ca and join Max. Thanks, guys and gals.